This segment is sponsored by Buckeye Health Plan.
When was the last time you saw your doctor without being sick? If it's been a while, you're not alone. Did you know that staying behind on these appointments can have devastating effects on your health? In honor of Preventative Health Month this August, I'm here with Dr. Peter Kambelos, Medical Director from Buckeye Health Plan, to discuss the importance of getting these appointments on the calendar. Welcome.
I'm happy to be with you and happy to be part of the Buckeye Health Plan family. So our motto at Buckeye is to improve the health of the community one patient at a time, and we sincerely mean that.
I like that, improving the health of the community one patient at a time. So when it comes to preventative health, what is your #1 recommendation for patients looking to take the first step towards prioritizing their health?
So my top recommendation is probably going to be to get patients to go and see their primary care doctor for an annual well check once a year. And if folks don't have a primary care doctor, those who are members of Buckeye Health Plan, we can certainly help them get one. Last year in the United States, only 1 in 25 people did not actually see their primary care physician for an annual well check. In fact, unfortunately, 60% of American adults will have some chronic health problem, such as diabetes, cancer, heart disease, and the like. And a lot of those things can be picked up early on in a well visit with their primary care physician. So very important to establish with the primary care physician. If you don't have one, we can help get you one. Make that annual visit.
Got to make those annual visits.
Yes.
Now, what risks are associated? You kind of touched on it a little bit, but what other risks are associated with patients not staying up on their annual visits and preventative screenings?
You know, regretfully, misdiagnoses, missed important health problems that if detected early on can be much more easily managed and treated. I'll give you some examples. Cancer is common diagnosis, unfortunately, but breast cancer, colon cancer, cervical cancer, and prostate cancer. All those, if identified early, in many cases can be treated much more easily and managed much more easily. 33,000 American cancer deaths could be prevented if people would get their cancer screenings done yearly.
33,000.
That's a lot of people.
That is a lot of people. And how does Buckeye Health Plan make it easy for members to stay up to date on preventative health appointments?
We make it really easy. As I mentioned earlier, if folks don't have a primary care physician, we will find them one. We will also get them to that appointment and take them home at no charge. Transportation is free. We also provide our patients a bonus of $75 for completing an annual health visit. In addition, we also will provide them with a $25 bonus amount to get their yearly flu shot and certain other vaccines. So we couldn't make it any easier for the patients to get an appointment with their primary care doctor.
That's quite the incentive. What common screenings do you recommend for your adult patients?
You know, in truth, health screenings are individualized to the patient's particular situation. Those decisions are best made in consultation between a patient and their primary care doc. A lot of those screenings are going to depend on age, sex, personal medical history, family medical history, and obviously the patient's personal preferences and how they want their health care managed. Some common screening recommendations we would make for adults would be, for instance, to start screening women for breast cancer with a mammogram beginning at about 40 years of age, colon cancer screening starting at between 45 and 50, prostate cancer screening starting around the age of 50 approximately, screening for lung cancer and those for increased risk. And in addition, some additional screenings that we can recommend at the time of a well check would be, for instance, screening for diabetes, screening for heart disease, cardiovascular disease, glaucoma, thyroid conditions, so many other diagnoses for which, at which time we can provide that screening information and in consultation with our patient, make the appropriate decision.
And so what do you say to people who say, I don't go to the doctor because I feel fine?
That's a tough one. We recognize that, and we're happy that they feel fine. However, once again, they could be missing out on screening for some very important medical conditions and diagnoses for which treatment and cure perhaps could be available early on if, again, diagnosed early.
And where can our viewers go to get more information?
BuckeyeHealthPlan.com will contain a lot of information on our website, and of course they can call the customer service number on the back of their card if they have difficulty with that. We can guide them.
Well, Doctor, thank you so much for being here with us today and giving us this great information.
Thank you very much for having me. Thank you. Pleasure to be with you.
And as he said, for more information, you can go to BuckeyeHealthPlan.com. Get those screenings.